Hi, welcome to the Ear, Nose, and Throat Institute. My name is Allison Robbins. I am the Director of Physical Therapy, and I am here today. I'm going to do a Facebook Live on how we diagnose and treat dizziness. We have a team approach at the Ear, Nose, and Throat Institute. We have doctors, audiologists, and physical therapists working together as a team to diagnose and treat your dizziness. This will help flatten the curve for the COVID-19 because we're keeping people out of the urgent cares and the emergency rooms, which may expose them to the virus that's going on right now. We want to take care of our patients, and we want to help you find out what's causing your dizziness. So I'm going to go through a little bit about what we do. How do we do that? Basically, as a physical therapist, we're looking at function. We want to know, when you come in, what's causing your dizziness? We're trying to rule out two basic things that cause dizziness. Is it your brain or is it your ear? The inner ear controls 60% of your balance when you're moving. So if there's a problem with the ear, it can throw off your balance and there can be a dizziness problem. So let me go through a few different things that we do to determine, is it your brain or is it your ear? We have some really amazing technology here at the Ear, Nose, and Throat Institute. In this room here, this is our video Frenzel goggle room. We use goggles that we put on your face that take real live video of your eyes, and we make you do a series of tests to find out what's causing your dizziness. So we go through first some brain tests to find out, is it your brain? Your eyes tell us a lot about what your brain and your ears are doing. So we put the goggles on your face, and we have you look at a big screen TV. There's a picture of someone's eyes, in the past that we have videoed. We do things with your vision, and then sometimes with your vision denied, or we put you in the dark. Okay, so that's the goggles that we use. I wanted to show you a little bit about what we're looking at. So we do things called oculomotor testing, and then we do things with positional testing to find out about your ear. So this particular patient, as you can see, we tested this person, and this person had what we call a vestibular neuritis. He had a virus that attacked the inner ear, not the COVID-19 virus, just a virus that attacks just like the common cold, the inner ear. His eyes look like when we tested him. And as you can see, that is not normal, okay? Your eyes should not be moving like that. This person was just in the dark, and his eyes were doing something called nystagmus. Nystagmus is eye movement. You notice that his eyes stopped moving because we gave him something to look at. When we gave him something to look at, the brain overtakes it, and he was fine. When we took the light away, you'll see the eyes start to beat again. That's one of many tests that we do to find out, is it your ear versus your brain. If it is your ear, there's a number of things that can cause it. This is the ear. So we have your outer ear, eardrum, middle ear, and inner ear. This is the structure that we're focusing on in physical therapy. This little snail-looking thing here is the cochlea. These are the semicircular canals called the vestibular system. This vestibular system can cause dizziness. There's a bunch of different things that we find out what is the cause. Is it benign paroxysmal positional vertigo, or a crystal that's out of place in your ear? Is it a vestibular neuritis or a labyrinthitis? There's a number of things that we're looking for to find out what's causing your dizziness. Based on what we find, we know how to treat it here at the Ear, Nose, and Throat Institute. We work closely with our doctors. We work closely with our audiologists to know what's the best treatment option for you without the use of medication. That's the even better thing. We can fix it without using medicine. So let me show you a few other cool things that we have here at the Ear, Nose, and Throat Institute. So we're going to now go out into our gym. We do a series of balance testing out in our gym. We do things using our overhead rail systems. We have harnesses that we put patients in to test their balance while being on the overhead rail system for safety. This is important because when your ear's not working, your balance is not working. You may feel off or unsteady. We try to keep our patients as safe as possible, and by putting you in this overhead rail system, there's no way possible to fall. It's a great avenue also for people over the age of 65 who are at fall risk. We can really challenge balance to improve their balance and any kind of dizziness they may be having as well. Another amazing technology that we use here at the Ear, Nose, and Throat Institute is if you come this way, we use something called a computerized dynamic posturography. So this amazing piece of technology here is we put patients in a harness within this machine. The platform is steady for part of the test and it moves for part of the test. What we're looking at when we're testing these patients are what's causing their balance issues and their dizziness. It's another piece of the puzzle so we can diagnose and treat you appropriately. We're looking at how well do your 3 balance centers control your balance: your vision, your inner ear, and your muscles, bones, and joints. The proprioception coming from those collectively called your somatosensory system. How well they work together matters, because if one or all or several of them aren't working, then it's going to affect dizziness. You will be dizzy if your ear's not working, if your vision is off. There's things that, and it may not be your 20/20 vision, how you see, it's how your brain thinks you're seeing, how it works together with your ear and your muscles, bones, and joints. Those are very important things that we're looking at to get a treatment plan to make you better. Another thing, if you want to come over here, we're going to look at, this is an example of one of the tests that we do on the computerized dynamic posturography. On this test, we're looking at this particular person. The gray bar is the norm for their height and age. The green and the red are how they tested. Green is good, bad is below the normal. So basically this person had visual and vestibular deficits and somatosensory deficits that's increasing their dizziness. We're looking at also how do they compensate for that dizziness. So we go down to this graph and it'll show us, are they using appropriate ankle strategy? Are they using hip strategy? Your ankles and your hips are the hinges where you control your balance. If your ear is not working appropriately, then your balance will not work appropriately and you will compensate at the ankle and the hip. So these are some of the really cool things that we see and how we treat at the Ear, Nose, and Throat Institute. We know how to figure out why you're dizzy. We want to help you get your dizziness to go away. Come see us at the Ear, Nose, and Throat Institute. Right now is not a great time to go out into the urgent cares and the emergency rooms. We want to help those guys too who are overwhelmed by bringing people in here to flatten the curve. Please come see us at the Ear, Nose, and Throat Institute. Let our family take care of yours.